Now or never, let's talk about 11 easy tips to reduce your creatinine levels faster. We are sure all kidney patients want to know about these tips. So here we are on our channel Kidney Expert to tell you everything you should know about kidney disease. Before we start with today's topic, please subscribe to our channel to not miss any updates or notifications. So, our very first tip is reduce the amount of protein in your diet. Yes, a high protein diet can elevate your complications, especially red meat. You need to keep an eye on the amount of protein you consume in a day. An excess of protein will stress your kidneys. Whereas if you keep it low, like you avoid too much animal protein and switch to a few fruits and vegetables, it will help reduce high creatinine levels. But what is creatinine? Creatinine is a waste product created by muscles in the process of breakdown of creatine compound. We all have creatinine in our blood as it is produced from the normal wear and tear of the body's muscles. The average level of creatinine in a body depends on age, gender, and body size. High creatinine levels may lead to severe kidney problems or even complete kidney failure. So don't forget to keep a check on the creatinine level in your blood. To test the creatinine level in your body, you should consult your doctor and investigate through required tests. Generally, the GFR test or kidney function test is the best way to know if kidneys are working properly and how much of creatinine is released from your body. They are simple routine laboratory tests. If GFR shows your filtration rate below 60 mg per deciliter and your creatinine level more than 1.2 mg per deciliter for continuously 3 months, then it is a clear case of a kidney disease. Another test is a urine test, where above 30 mg per mg indicates kidney disease. Your kidneys are directly affected by the high amount of creatinine as your kidneys are pressurized to remove it. Overburdened kidneys are likely to get diseases and may result in kidney failure as well. Kidney stroke is most common in patients with high creatinine levels. But do not worry, as we on Kidney Expert promised you to give 11 easy tips to reduce your creatinine levels, you will surely see a good change in your health if you follow them. Second is, do not let your blood sugar levels get increased. High blood sugar levels or constant inflammation is also a reason for high creatinine. So what you can do is take a diet that carries low sugar and low calories. You should also exercise and practice yoga asanas like Ardha Matsyendrasana that are good for diabetic patients. Speaking of yoga and exercise, our third tip is do not stress your body with exercise. Do not take part in any vigorous exercise or sports. The more you pressurize your body physically, the more it produces creatinine. So you know what to do, right? Do breathing exercises, perform yoga. Do not lift weights or do any gymming and avoid playing strenuous games. Let's move to the fourth tip. Say no to junk. I know it's difficult, one of the most common phrases but most overlooked as well. We keep eating junk like anything despite the fact of how it is affecting our health. But if you want to reduce your creatinine levels, you have to put a strict full stop at junk food. Fifth, both potassium and phosphorus should be in limited quantity in your diet. Kidneys are also responsible for the electrolyte balance in your diet. When kidneys are weak and creatinine is high, both these electrolytes can stress your kidneys. They can also be a reason for swelling in your limbs. Number 6. Strictly avoid creatine supplements. Many youngsters take protein and creatine supplements for bodybuilding for high energy. But these proteins can damage your kidneys. Our focus should be inner health and not how others see us. 7th, eat more fiber-rich fruits and vegetables. Oh yes, fiber-rich fruits and vegetables help reduce high creatinine levels. Eat apple. Add vegetables like bottle gourd, snake gourd, green pumpkin to your diet. They soothe your digestive system and help reducing elevated creatinine levels. They reduce high creatinine levels by eliminating the waste from the body. Is your blood pressure in control? I hope so because it is my 8th tip. To reduce your elevated creatinine levels, you should also keep a watch on your blood circulation. So to keep your creatinine level low, keep your BP stable. The next and ninth point in my list is stay away from packed and processed food items. I am talking about sodium-rich products, frozen eateries, nuggets, hamburgers, ice cream, cake, cookies, cold drinks, processed chicken. Frozen chicken are quite rich in sodium. High sodium in the diet leads to swelling in your limbs, which again stresses your kidneys and increases your creatinine levels. So just avoid them. Now the 10th point is quit smoking and drinking today, or I would say now, because reckless smoking or drinking affects your arteries' health, which is directly related to your kidneys' health. The choice is yours. The last and most important one is adopt Ayurvedic treatment. I mean, there is no better tip I can suggest. Ayurvedic treatment is best to reduce high creatinine levels. In comparison, allopathic doctors are still struggling to treat kidney disorders. They have no clue how to reduce elevated creatinine levels other than dialysis, which we clearly do not support. If a healthy lifestyle, a healthy diet, and naturally comprised herbs can revive your kidneys, reduce your high creatinine levels, then what is the need to go for allopathic doctors? A renowned Indian doctor, Dr. Puneet Dhawan, has cured many patients only through his Ayurvedic expertise. If you still have doubts about what I am talking, let us see an example of how Ayurveda treats kidney patients.
My name is Santosh Nagar.
And where are you from?
I'm from Mumbai.
Mumbai?
Yeah.
Okay.
I found out about Karma Ayurveda. And after continuous follow-up for last 3-4 months, I finally came in the month of September.
Okay.
To be precise, September 22nd.
Okay.
That time my creatinine was 2.70.
Okay.
And now after 3 months it is 1.90. So I have seen a tremendous improvement in and I am really very happy. And that is the reason why I have come here for the second time.
Okay.
That's how. And coming all the way from Mumbai, it's not very easy also. You need to plan a lot. So that's how I have a very good improvement in the last session. So I hope this session also I will be completely cured.
So these are the reports that you have done.
Yeah.
And 2.70 was the creatinine level when Mr. Santosh Naganathan,
Yeah.
am I pronouncing it right?
Yeah, absolutely.
So approached us, and creatinine level was about 2.5.
Yeah. After completing 1 month of the course, 1 month and 1 week to be precise, that time it came down to 2.17. From 2.70 it came down to 2.17. And then the last test, I think I took it the last week
It is
of
24 December 2018, and now this time the creatinine level is further reduced and it has came down to 1.90. And there is a level called eGFR, estimated GFR, which has been done from the same lab, and it has increased to 42. In the previous report, it was about 36. The creatinine levels and in the glomerular filtration rate of Mr. Santosh.
I wish I could know about Dr. Puneet a bit earlier. I could have, recommended my uncle who passed away 10 years back because of due to kidney failure. He had a creatinine above 6 or 8 or something, and he passed away in 2008. I wish I knew at that time, but there's nothing we can do about it much. But going forward, I can recommend to a lot of anybody known to me who are suffering from the same ailment. Definitely.
Okay. So these are the reports of Mr. Santosh, and he has already cleared out his message that what are the improvements that he has seen in the last 4 to 5 months, and the creatinine level has significantly reduced, and the glomerular filtration rate has increased way much increased from the last time. Because of the decrease in the creatinine level, the GFR has increased. So here is a testimonial of one more satisfied patient who is coming from Mumbai, all the way from Mumbai, and along with the reports which were done at Mumbai only. So we can, we can say it with lots of courage and lots of faith that kidney patients can definitely improve. And those who are on dialysis should start the treatment as early as possible so that the dialysis dependency can be reduced. And also those who are not on dialysis and are on initial stages can start the treatment so that this disease doesn't deteriorate further. Because as the nature of disease, it's a progressive disease, it keeps on increasing by itself. Stop kidney dialysis.
So, did you see how Karma Ayurveda's Ayurvedic treatment has clearly outshined the painful Western protocols like dialysis or transplant? So, if you or any of your loved one is dealing with any kidney disorder, then dial the helpline numbers flashing on your screens. We are India's leading Ayurvedic kidney care hospital. Our address and our helpline numbers are flashing on your screens. Please feel free to contact us. We hope you like this video. If yes, please hit the like button. We all know how grave coronavirus is and how rapidly it is increasing. So we request you guys to wear masks and use hand sanitizers frequently. For more such videos, keep watching our channel and do not forget to share this video and subscribe to our channel. Thank you for watching this video.